Intellicell Biosciences sets up tissue processing labs around the world so we can service physicians. The physicians will remove fat from patients, send it to our lab. In the lab, we'll process the fat, return it the same day, and these doctors can take these autologous homologous cells and use them off-label to treat many various kinds of patient ailments. We take out some fat, we get rid of the fat, and we're left with a population of cells. It's this population of cells that we kind of nickname the soup. This soup of cells that's left over after you remove the fat are the cells that's actually making you better. The Intellicell Biosciences cells are not controversial because they're not fetal, they're not embryonic, they're actually cells from your own body, your own fat. Therefore, you can't be allergic to them, there's no diseases. It's no different taking out a pint of blood, waiting an hour, and giving you back the same blood. So there's no safety risk at all. I've actually had patients where we've taken out 2 ounces of fat, produced the Intellicells, and we've treated anything from wrinkles to breast augmentation. We've seen osteoarthritis get better. We had a patient with bone on bone in the knee who was pain for years, and we actually were able to treat him and reduce all his pain and make it go away. He's been pain-free and limb-free for about a year now. We've actually had a periodontist treat 3 patients for gum recession successfully where there's been no grafting at all. So we're seeing a vast number of diseases that we can treat with your own cells, and I think that's important. Intellicell Biosciences is setting up tissue processing centers all across the country. These centers will be able to take in fat from all the local physicians, process the fat into stem cells, and the same day return the stem cells to the doctors under autologous homologous, and the doctors can use these stem cells off-label for their patients. Under the FDA rules, we have to return the cells in the same day marked autologous homologous, and then the physician, under their medical license, can use these cells to treat their patients. The FDA has approved this procedure of taking the adipose tissue, making these cells under the 361 laws, returning them to the doctors for clinical use under their medical license. At the same time, the company has set up clinical studies with multiple medical centers to get FDA approval for actual indications. Intellicell Biosciences, I think, is going to change the way medicine is practiced in the U.S. because a lot of things like just a hip replacement, a simple thing, you can take these Intellicells or stromal vascular fractions from the fat and actually treat the patient's hip, and you can probably avoid surgery in 85% of the patients. So these cells that we're taking from our own fat are going to be probably the gold standard for many therapies of the future.